So with that, I'm going to actually introduce to the stage Bob Fine, who is going to give us a short overview of the IVRHA. I mentioned IVRHA yesterday. We're really proud to be partnering AMXRA and IVRHA together on the new Journal of Medical Extended Reality. There's a booth out there. If you haven't seen the JMedXR booth, check that out. And Bob, come on up and tell us about IVRA.
Brandon, thank you. So I've got 5 minutes. I'm going to go through this quickly. This is my first VMed. I've been enjoying it immensely, and it's been fantastic. So first, I just want to say thank you again, Brennan. I was very, very humbled from the slide yesterday and the mentions. And I am here to support you and Mark in any way I can and this community. I just want to see it grow and succeed along with everyone. So just a brief background about myself. I spent first half of my career as a systems engineer, RF, mechanical engineering, and a lot of field work, mostly overseas, a number of large and small companies. And then I had the privilege and a dream job opportunity and spent 10 years with Conservation International and built their network out in 40 countries and traveled overseas half the time. That led into actually right after the downturn in April of 2009, I, by chance, organized what ended up being the first social media conference on the East Coast back in June 2009. And PBS NewsHour was there and filmed a 20-minute piece, and it got a lot of attention over the summer. And I did a number of events. I didn't know what I wanted to do after the conservation work. And I started what's still today the only print magazine about social media, and called the Social Media Monthly. But we had global distribution. It was a great ride. Only time I raised any money, and it was a 2-month marriage and a 3-year divorce. And I'm happy to share that over a beer at some point. This was our healthcare issue, though. This is from 2013, more than 10 years ago. And I think you can tell by the person's face, and they're pointing to where does it hurt? Twitter, Facebook, any number of things. We were talking about this a lot yesterday. I started experimenting in different VR, doing different VR events and trying to see where the interest was, shortly after Oculus got bought by Facebook. We did this first VR healthcare event at GW Hospital in Washington, where I'm based. Walter was a remote keynote presentation. And then I asked Walter for his help to put on a follow-up conference that we did at Harvard Medical School the year after, and we had 250 attendees. And Walter's been instrumental in helping me get the association going, and Walter, thank you. So we launched it in March 2019, 5 years ago this month, with 40 founding members. Those are those 40 founding members. A lot of that slide has changed. Some companies have come and gone. Some have gone out of business. But today we're at about 125. It's a mix of small garage startups to teaching hospitals, universities, research organizations, about 35% outside the United States. And it's just every day it is something new, and there's never enough hours anymore. So I started doing this presentation back in 2017, and this is just very briefly my take. I slowly lowered this number. I started at 99% back in 2017. I'd say maybe we're at 90%. We keep making progress, but the reality is the majority of people working in healthcare aren't familiar with VR, haven't tried it, don't even know that there's a connection with healthcare. And 20% of our economy is made up of healthcare. This is a very large amount of ground to cover. It's going to take time. Is that 5 years? Is that 10 years? Is that 15? This is a generational effort. So our number one focus is education, education, and more education. We finally did a pilot tour last November. We took 12 companies to 3 cities, 3 days in a row, Pittsburgh, Cleveland, Columbus. It was a free open VR healthcare demo day. The goal was just to drive as many people that had an interest in healthcare or technology and heads and headsets. We had our first hackathon just a month and a half ago. Was really happy with it. It turned out great. We had 8 university teams, teams of 3 students, mix of grad students, undergrad. Of those 8, 2 to 3 of those were easily commercially viable. It was just brilliant what people came out with in 36 hours, and we had a great team of mentors. I think one of the best values we've been able to provide, we started doing 3 years ago, is this university program project. I'm putting this out 3 times a year, spring, summer, fall. We've built a lot of relationships with universities across the US and Canada, graduate, undergrad programs. All these have capstone requirements, and we've been able to match up members with these courses to get very solid work done. With a little thought, you can get a lot of value out of it. Just today, I got word that Dr. Marie Pavini, one of our members in Rutland, was just named the SBA New England Manufacturer of the Year for her company, Healthy Design. And they've been using VR for training nurses about delirium and how that can be prevented. Very briefly, be the champion internally at your university, at your hospital, at your organization. Be the one that leads and schedules a meeting and get people that have any interest and just meet monthly, and you will see it start growing. We've seen it happen at other schools. And lastly, my challenge, whether it's our conference or VMed or a combination next year, over the next 11 months, bring one new person with you next year. With that, if you focus on bringing one colleague, a friend, a student, your chair, we can double this community in a year. And that's what we need to do to grow this market. That's my contact information. Thank you.